The program's director for basic needs, an international non-governmental organization working to improve the lives of people living with mental illness and epilepsy. Adams, welcome to News Desk.
Thank you very much for having me.
So today is World Mental Health Day. First, tell us, what have you been finding out on the ground yourself?
What we found out is that mental health is a reality. Whether you believe in its existence or not, it is a fact of life that there are people who suffer ailments which are not physical in nature but has to do with conditions of the mind. So it is a reality that we have come to accept, and it is prevalent in Ghana.
Based on what you found, is it increasing, a lot more people getting mental health, illnesses in different ways?
Mental health is on the ascendancy in Ghana for so many reasons, which we may look at later on. But yeah, if you work with the healthcare professionals, you will realize that the number of people going in for treatment, if you go to work in the community with families or people with mental illness, you realize that each day, each time you visit a community to meet with mental health service users and their caregivers, at least there are always new members coming on board.
Are you able to give some comparative statistics? Maybe if in 2012 there were these numbers of people suffering from mental illnesses as compared to 2016?
I may not be able to tell you offhand that in 2012 this was the number and in 2016 this is the number. But if you look at globally what the WHO estimates for us as a country, if one in 4 persons is likely to suffer one form of mental disorder or the other in his or her lifetime, then we're looking at a great chunk of our population, that is more than 2 million people, likely to be suffering from or are likely to experience one form of mental disorder or the other. But we see a few on the streets, that is the chronic mentally ill, and they seem to constitute about 1% of the total population likely to experience one form of mental disorder.
Do you think the illnesses are increasing amongst people because, there's a stigma attached to somebody going to go to the hospital to check on his or on her mental status? So people keep it until it gets out of hand, and thus it's increasing the number.
The stigma may not be the cause, but it may contribute or it may influence the way people seek treatment. So yes, it might occur at a stage. The people or families with relatives with